Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for joining for our weekly COVID-19 update. Today should be an especially quick one, not a lot of significant developments to share. But of course, as we continue to work our way through this, always want to be sharing what we do know, the progress that we're making. At the top level, pretty much, I'd say, net positive news to share. In some things are improving in terms of the situation with COVID-19 in the county. Numbers are coming down, but things are still very tenuous, and we still have work to do to bring numbers down and ultimately hold them down. Ulster County does remain in the highest risk level per the CDC. If you remember back a few months when the CDC established their different levels of community transmission risk, we are still in the highest level, despite the fact that we have seen our active case numbers come down to about the lowest they've been in around 2 months. So while we are making progress in bringing down the rate of infection and active cases, we're still at significant risk, technically high risk per the CDC. And our health team and our health commissioner agree with that as well. So we have to keep our guard up is really what I'm saying here. Diving a level deeper into the metrics, active cases in the county are at 285 active COVID cases. Again, that's down from around 600 that we were at about a month ago. So we have seen a steady decline in active case count. That is a credit to everyone taking precautions, wearing masks indoors, and mostly we attribute that to the vaccination progress that we have made and continue to make. The new positive case rate is up slightly from what it was last week. We're at 3.3%. We were down into the twos last week. So that is the 1 point for concern, meaning each day we're seeing a little bit higher numbers of new positive cases, which if that continues, of course, would bump things back up. So that is the reminder and the data point that encourages us to continue to be cautious. Hospitalizations are slowly coming down. We're at 8 currently hospitalized in Ulster County beds, 2 of them ICU beds. And thankfully, in the last week, we have not had any additional fatalities of Ulster County residents due to COVID. So we're at 281 total fatalities due to the pandemic. The breakthrough case numbers, meaning the number of individuals who were vaccinated but became COVID positive, are still very, very low. We're at 1,187 breakthrough cases since we began tracking that in April over the last 7 months. That is a 0.92% breakthrough rate, meaning if you've been vaccinated, you have less than a 1% chance of being COVID positive. That is very encouraging. And hopefully continued additional evidence for those that may be still weighing whether to be vaccinated or not, that vaccinations are not only safe and easy, but also extremely effective in preventing the spread of COVID. And for those that are breakthrough cases, we've seen the seriousness of those cases continue to be lower. We are continuing to make vaccination progress in Ulster County. Thank you to everyone continuing to be vaccinated. We are now at 82.6% of 18 and up residents vaccinated, so that's great. And we're at 72.4% of all residents of all ages. So again, we remain just ahead of the state average and certainly leading in the region and in most parts of the state. So let's continue that progress. I'm going to talk a little bit about what we're doing on our vaccinations. We're continuing our Vax to School initiative, another phrase that I never thought I would say, but it's 2021 here. So Vax to School continues in the upcoming 2 weekends. We have 4 additional school districts that we'll be partnering with so that 12 to 17-year-olds who are eligible, who have not yet been vaccinated, you can actually go to your local high school on the weekend and get vaccinated. By doing so, you are also eligible to be one of 2 residents who would win a full scholarship to SUNY Ulster. I want to thank the SUNY Ulster Foundation for their partnership in helping to fund that. The dates coming up for that: this Saturday, October 16th, we'll be at Saugerties High School. On Sunday, the 17th, Rondout Valley. Next weekend, October 23rd, at New Paltz High School. and then Sunday, October 24th at Onteora High School. I'm sure those districts are pushing that out as well, but I want to make sure, please spread the word about that. We are starting to see the number of 12 to 17-year-olds getting vaccinated pick up, which of course is very helpful to keep our schools safe as we continue to have them operating and running. I'm sure all the parents out there are checking the COVID numbers in your schools and in the county, but overall they look very good. We've seen very low case numbers in schools, and that is really a credit to particularly our teachers, parents, students, school leaders. So thank you for that, and let's of course keep that going. As it gets colder, as we're now well into the fall, as we're going to have to be indoors more, it's even more critical that we keep using these different tools that we're seeing work, from vaccinations to masks indoors and other precautions, so that we can keep things running, we can keep our schools going, we can keep our businesses open. We all know what we've been through the last 18 months, and we all know we certainly don't want to go back to that. The last update is just our booster effort continues. Once again, we've sent out very specific technical details there about eligibility criteria and so on and so forth. So please check vaccinateulster.com or check your inbox if you signed up for our list. But in sum, that is currently only for Pfizer. Individuals that have received the Pfizer vaccine are eligible for boosters, and it has to have been at least 6 months since you received your second shot. So we've got many thousands of folks in the county who are eligible. We're continuing to run our booster clinics at our Hudson Valley Mall County Pod site. You can also get them at many of our other vaccination partners, from pharmacies to doctors and so on and so forth. We also know that at the national level, FDA and CDC are currently evaluating applications from both Johnson & Johnson and Moderna for boosters for those shots. So we'll continue to monitor that. If and when they become available, which likely would be in the next week or two, we'll send additional updates out to everyone that's signed up. If you want to be getting updates about vaccinations and boosters and you haven't already, you can go sign up at vaccinateulster.com. That has all the details about everything I'm saying here. It has links to our COVID dashboard. So if you don't want to hear me ramble on, you can just go check out vaccinateulster.com and get the quick information that you need and share that out. Those are really our big updates for today as it relates and this week as it relates to COVID-19. I'm encouraged by the progress that we're seeing. We are seeing the numbers come down, but looking back to a year ago at this time, if you remember, which feels like ages ago, but a year ago at this time, we had gotten through the first wave. We were coming up to Halloween, we were coming up to Thanksgiving and the winter holidays. And the COVID numbers a year ago were actually lower than they are right now in the county. And we really started to see the numbers aggressively go up right around Halloween gatherings and Thanksgiving gatherings. So the good news is this year we have vaccines. So that is a critical game-changing tool we have to hopefully keep those numbers down. But I do want to remind folks that we are getting back into that higher risk period in terms of more being indoors. And so it is not a time to let our guard down. We are all sick and tired of masks, but they have certainly proven to work, especially in the face of the Delta variant that hit us a few months ago. So let's keep doing the things that work. I appreciate all of your all's help and participation and support in that. And I want to thank, as always, all of our frontline workers in our county team, from our public health nurses to those running our vaccination sites, all of our healthcare workers across the county, all of those that are responding to other calls and needs as life continues to go on here. We appreciate what you're doing and what you've done. On that note, we will see you for our COVID update next week. Hopefully, we'll continue to see positive directions of all the metrics and positive improvements. In the meantime, please stay safe and healthy. Let's continue to stay resilient and support each other through this, and we will see you soon.